Good evening, ladies and gentlemen. Welcome to this session. I'm going to tell you about our very own program called Break the Cycle of Children's Environmental Health Disparities. First of all, to say that everything I say is all my responsibility, and those who funded the work I do are not responsible for that. Health disparities are defined by the differences in health that are closely linked to social, economic, and environmental disadvantage. That's a quote from Healthy People 2020. So let me translate that into real health issues for you. In this particular slide, you will see on the lower line that says wealthy mothers, and that is the infant death rate per 1,000 births in the US. And the line above is the infant death rate in the US for disadvantaged mothers. The same country, two different realities. This particular reality is to be found in other wealthy countries of the world. And this particular reality, with more than 5 children dying per 1,000 live births in the US, is more like poor countries in the world. We are dealing with this wide gap, and this is called a health disparity. What makes the difference between wealthy and disadvantaged mothers is what we are going to examine today. One of the issues of disadvantage is poverty. And poverty comes in various shapes and sizes and affects different people differently. This data is from an article in Pediatrics a couple of years ago on mediators of child poverty and the impact of child poverty. And they looked at race and found that of white children, 12.3% were poor, but of Black and Hispanic children, more than 30% were poor. That's 3 times the rate. Education, children who had some education, some college education, only 13% were poor. And for those who had less than a high school degree, 57% were poor. That's more than 4 times the rate. For families where one parent works full-time, only 9% are poor, but when no parents work, 48% are poor. That is more than 4 times the rate. We look at family constellation, and for those families where there are 2 parents, only 12% are poor. But for single female-headed families, 42% are poor. And the sad reality is that children of single mothers are at greater risk for infant mortality. That is, they die, and that contributes to the high infant mortality you saw in the first graph. They are more likely to be subject to child maltreatment, that is child abuse, more likely to fail to graduate from high school, landing them again in poverty, and more likely to be incarcerated, which not only puts them out of society, but costs society significantly. So where do these people live? They live in poor communities. What are the characteristics of poor communities? Characteristics are unsafe neighborhoods, a lot of traffic, crime, litter, trash, food deserts, and limited green space. And as a result of these adverse environmental circumstances, their children are 60% more likely to be obese, and they're also more likely to experience violence and exposure to drugs and other substances. They also live in older houses, and the older houses are more likely to have used old paint, which was contaminated with lead. So they're 3.5 times more likely to have lead toxicity, and lead causes brain damage. And they are twice as likely to develop asthma because of the poor air quality in the houses and outside the houses. And the saddest reality is that they're 3 times more likely to die of asthma than their more affluent white counterparts. They also go to schools that are older and in less good condition, and the teachers are not as highly paid, and the teachers are not as enthusiastic, and the graduation rate at these high schools are at 50% rather than closer to 100%, and the children are twice as likely to be unemployed after school. And how does that look when we take all these factors into consideration? It looks like this: a cycle of health disparities. If we go to the upper left corner, which is the reddish color, we see that these people who've dropped out of school, who have limited education, have limited employment options, they have limited income, they have limited healthcare resources, limited social capital, limited impairment, they have income insecurity, food insecurity, housing insecurity. They live in those poor neighborhoods that I've just described, which causes stress and environmental exposures like lead and asthma. And that results in vulnerable pregnancies with an increased likelihood of premature infants who are more likely to have developmental problems as they get older. To adversely affect health, we spoke about asthma in the homes, we spoke about obesity in the neighborhoods, heart disease, developmental disability from prematurity, and because of all the stress, they develop mental health problems of toxic stress, post-traumatic stress disorder, more substance abuse, more violence, and they get trapped in this cycle of health disparities. The question is, can we make a difference? Absolutely. Positively, we can make a difference. I'm going to give you some examples of how we can make a difference. This is a mother rat. And mother rats, being mammals, will nurture and look after their young. You can see her little paw cradling her infant, and she is licking and grooming her infant. That's what mother rats do. They lick and groom their infants. And this is an elegant piece of research done at McGill University more than 10 years ago. And on the right, you will see it says high licking and grooming. These are happy mothers who lick and groom their little pups. And these little pups go on to have low anxiety. And they, in turn, when they have little pups as mothers, they will lick and groom their little pups. In contrast, rats who did not lick and groom their pups had neglected little pups who then had high anxiety, and they, in turn, when they had little pups, did not lick and groom them. So you can see how that could lead to a cycle of intergenerational cycle of disadvantage. However, these researchers took these little pups, these neglected pups, gave them to a licking and grooming mother who licked and groomed them, and it turned out through epigenetic mechanisms, they in turn had low anxiety, and they then licked and groomed their offspring. So we can break the cycle. Now, not all of us work with rats and are rats, but if we can do it with little kids as well. This example, this research was done in the 1970s. It was called the preschool program. And what they did was take poor children with low IQ, give them a really good early intervention program with 2.5 hours of preschool program in the weekdays and weekly visits to their home by their teachers. And then they followed them up at ages 15, 19, 27, and 40. This particular graph shows the results of the evaluation of these children at age 27. The children who had the preschool program are in the darkly shaded blocks, and the controls are in the lightly shaded box. So I'm going to walk you through the results, which shows in the extreme left-hand side that less children who had this early intervention program required special education. More children achieved greater than the 10th percentile. More children graduated from high school. More children earned more than $2,000 a month. More of those children had their own homes, and more of them never went on welfare. So what happens is that this group of adults then contributes to society, and not only do they benefit personally, but the whole of society benefits from the fact that funds are not spent on welfare. Early education is the answer. The researchers were headed by Jim Heckman, who was a Nobel laureate in economics at the University of Chicago, and he calculated that the rate of return on investment was $7 to $8 on the dollar, which is a very high investment by any standards. Another piece of research done by economists at Harvard and Columbia universities examined 1 million children from a large urban school district from 4th grade into adulthood. And what they looked at was the outcomes of having a value-added teacher. What is a value-added teacher? It's a teacher who improves the scores of the children in her classroom. So if you have a look, the dotted line represents the average. The solid line is the children who scores before the teacher came into the classroom, and the line after the vertical line is after the teacher enters the classroom, and their scores increased dramatically. So what happens to these guys 28 years later, or at age 28, I should say? They earn more money. These are the guys who earn more than $2,000 a month. And these are the similar individuals who experienced the early intervention in the last research project. So these had one single teacher who made an impact on their scores in 1 year, and as a result, at 28, they earned more money. So the question then I ask is, how can we, each one of us, make a difference? And how we do it in the Break the Cycle program is we recruit bright and creative students from universities around the country and around the world to develop projects that will break the cycle. We work with the students and their mentors at their universities to complete their projects. These students will then present their projects at a university, at a conference at Emory in Atlanta, and then the students will write up their projects for publication. And now, 15 years later, and this is 15 cycles, annual cycles, we've had 150 students from 50 different university departments, from 12 states in the USA, as well as many from Latin America. We had one from Europe, and we've had 2 from Africa. These resulted in 12 international journal supplements and 12 books. Our very first international journal was International Journal of Child and Adolescent Health, and the first book that we published was called Break the Cycle of Environmental Health Disparities, Maternal and Child Health Aspects. What we're going to offer you today is a sample of what we do every year. And instead of having students, we're going to have the mentors of students, and each mentor had mentored more than one student for our Break the Cycle program. The first mentor is going to be Julie Herbstman from Columbia University in New York, who's going to tell us about lessons learned from a 20-year birth cohort looking at the environmental influence on health disparities. We'll have Dr. Dana Barr from Emory University, who has also mentored a number of students, Break the Cycle students, on reducing exposure to environmental chemicals. We'll have Dr. Cappy Collins, who is at the Mount Sinai School of Medicine in New York, and he's going to talk about environmental approach to health disparities. And finally, we'll have Dr. Peggy Gallagher from Georgia State University, who's going to talk about understanding young children with disabilities and their families. And together, these mentors and their 150 students will break the cycle and reach levels of health equity, which is our goal. I'm going to leave you with one thought, and that is that even though we're not able necessarily to complete the goals that we have, we still have to undertake these goals and pursue them as much as we can. Thank you.